Welcome to Park Avenue Plastic Surgery Class, the podcast where we explore controversies and breaking issues in plastic surgery. I'm your co-host, Summer Hardy, a clinical assistant at Bass Plastic Surgery in New York City. I'm excited to be here with Dr. Lawrence Bass, Park Avenue plastic surgeon, educator, and technology innovator. Today's episode is the start of a new series about the facelift. What are we talking about in this episode, Dr. Bass?
This is the first episode in our new facelift series to provide an introduction to what we're going to cover. I want to give our listeners an overview so that they can see all of the content we have planned.
Before we talk about the content in the series, why did you pick this subject for a whole series?
That's a great question, Summer. So this is something we've talked about before on the podcast, but there's so much to discuss about facelifting. It's central to my practice, which is focused on facial rejuvenation. The facelift is the gold standard for restoring the aging face. It's basically the big reset for facial aging. That's your big playing card. There's still no meaningful substitute in 2025 for the facelift procedure or anything that's even close. So if you really have a lot of lax skin, the facelift is the only option that's going to make a meaningful inroad on that. Even that being said, the facelift continues to change and evolve. It's not your grandmother's facelift. And so it's important to discuss where facelift is in 2025 because many people are walking around with ideas about facelift that are either myths or that are based on facelifts from decades past. So for all of those reasons, we wanted to do a number of episodes discussing a whole range of questions. And plastic surgeons that work on the face are always analyzing their facelift results. They're trying to refine their techniques and improve outcomes. So the facelift is always changing in the medical community at large and in each individual surgeon's practice. And even though this is a very captivating subject for plastic surgeons, we're very excited to think about and talk about facelifting. It's also something that's fascinating to lay people who are just interested in plastic surgery or those who are thinking about their beauty treatments. And so we thought we'd work through a number of those issues on the podcast.
That makes a lot of sense. So how are you going to approach this?
There are many controversies surrounding the facelift. I always like to present different outlooks and bring guests who can discuss the reasons for their opinions. I also like to rely on evidence in the medical literature. To help with that, we'll have a guest on most of the episodes of this series. I'd like to introduce Dr. Kylie Edinger. Dr. Edinger is a plastic surgeon who is one of the aesthetic plastic surgery fellows with us at Manhattan Eye, Ear, and Throat Hospital in New York City, spending a year doing the aesthetic plastic surgery fellowship. This is a Northwell Health program that's one of the premier fellowships in aesthetic plastic surgery in the United States. Prior to working with us in New York City, Dr. Edinger completed her plastic surgery residency training at the University of Wisconsin. She's graciously agreed to work on this series with me, helping with the discussion and with the research. Dr. Edinger, thank you for joining us.
Yes, welcome, Dr. Edinger.
Thank you so much for having me. Like Dr. Bass said, I'm one of the fellows at Manhattan Eye and Ear, and I'm spending the year trying to learn as much as possible in this wonderful city from all these wonderful mentors. So I'm very honored to be here today.
So to start, Dr. Bass told us a little bit about why he's interested in examining the facelift in depth. Can you share your thoughts about why you're interested?
Yeah, as a trainee, we're always learning new techniques and methods of how to do various surgeries from our mentors, and the facelift is no exception to this. There are different ways to redrape the skin, different techniques used to manipulate the deeper connective tissue layers of the face, and different subtleties and techniques used by surgeons, including drain use, ways to prevent bleeding like a hemostatic net, and the use of adjunct procedures like fat grafting. I love talking to my mentors about why they use certain techniques and modalities and what they've learned and changed over their years of experience, and getting all of their tips and tricks on how to do a great facelift. We all want to do our best for our patients, and I think learning from each other helps us to continue to improve and evolve so we can do that.
Okay, that's great. I think that I understand the idea behind the series. So what can you tell me about plans for episodes and content? What can the listeners look forward to?
Well, we'll have a few general categories of episodes covering various techniques, controversies, and what the facelift can and cannot accomplish.
Typical decisions that doctors and patients make together, like about which incisions to use.
What kind of assessments are made during consultation, what to expect during the procedure and during the recovery process.
Different variations in the procedure, including neck lifts, mini lifts, and others.
Yeah, there's including deep plane facelift, neck techniques, plications, and smadzectomy techniques.
We'll also discuss facelift myths and logically analyze some of the fundamental principles to determine if they really make sense or not.
We'll also discuss anything in the news about facelift or big new developments from any of the plastic surgery meetings.
That all sounds really interesting. I can't wait. So who is this episode for, and how should they use all of this information?
Like all of our podcast episodes, these are designed for lay people. Anyone who wants to learn more about plastic surgery or who is trying to learn background information to help with planning and decision-making for his or her own plastic surgery care. This particular series may also be useful for plastic surgery residents who are building their fund of knowledge and trying to understand the evolution and current state-of-the-art of facelift. The information in the episodes is not designed to give an absolute answer, but to explain the rationale and principles behind different approaches to facelifting. In some cases, this is based on my 30-plus years of experience, and in some cases, it's based on data in the medical literature. Like most of what we discuss in the podcast, this is my approach or opinion. At the end of the day, you need to meet with an experienced, board-certified plastic surgeon, relate your concerns, listen to his or her analysis, and go with the surgeon you feel comfortable working with and who makes you feel heard.
And do you have any advice for our listeners about this series, Dr. Edinger?
Yeah, my advice is to listen and learn along the way with us, but to remember that at the end of the day, you and your surgeon will come to a decision for which technique is best for you, just like Dr. Bass said. None of these surgeries is a one-size-fits-all procedure, and each surgeon and patient will really have unique factors to consider together as a team. This goes for trainees as well. Part of the fun of facelifting surgery is exploring the artistic expertise of it and learning how to apply the many colors and brushes that are available to the artist to meet each individual patient's needs. So facelift surgery is always evolving, and we are lifelong learners in this endeavor, so try to have some fun too.
Thank you, Dr. Edinger and Dr. Bass, for previewing this series for us. I'm sure the listeners are excited as I am to watch this series unfold and learn about the facelift in depth. Thank you for listening to the Park Avenue Plastic Surgery Class podcast. Follow us on Apple Podcasts, write a review, and share the show with your friends. Be sure to join us next time to avoid missing all the great content that is coming your way. If you want to contact us with comments or questions, we'd love to hear from you. Send us an email at podcast@drbass.net or DM us on Instagram at drbassnyc.